Another common question is, when should a woman get a mammogram? And that depends. Not surprisingly, that every patient is different, and the factors that indicate when to get a mammogram vary considerably. And even the recommendations of the various organizations, American College of Surgeons, American College of Radiologists, for example, have changed over the years. It used to be that mammograms were routinely recommended once a year after the age of 50, and that's still certainly a very safe program. But there are other patients who should have it before that. A patient who is at high risk for breast cancer. And what's high risk? Having had a breast cancer previously is a high risk. Having had a mother or a sibling who's had breast cancer, that's another high risk factor that might trigger the need for a breast routine annual mammogram, perhaps at the age of 40. All of those are different than the patient who presents with a mass, or patient who presents with bleeding from the nipples or dimpling of the skin, or an abnormal examination by a physician or the patient. That whenever there is an abnormality on clinical examination of that breast, it's time for a mammogram. And while we're talking about mammograms, serial mammograms are often necessary as well. Mammogram may show some abnormal calcifications, may show an area of increased density, but it's not highly suggestive of cancer. Nonetheless, it makes it possible. Repeating that mammogram in 3 months or 6 months is a very, very sound practice that most physicians should do when there's reason to suspect that cancer cannot be excluded. So mammograms, when you should get them, it depends.